course, I have a coughing fit as soon as. Hey,
Hi.
am I? Do I look kosher?
You look great. I'm just waiting for a couple
Ooh,
more people to sign in. How about on your side?
what was that?
Can you see who's signing in on your side?
Yes.
Okay, great.
What's up, Sam? Say hi to little Sam. You'll meet Sam one day. She's great.
We love the hearts.
What's up, Peg?
Aw, I miss you.
Man, COVID has really messed things up for everybody. I know, but it's made everybody, I think, more comfortable with all of
You too.
this, which is
Oh,
good.
it's Turtle. Hi, Turtle. Yes, surprise. Surprise. Yes, I'm behind Suturebuddy as well. Oh, Justin. Hey, Justin.
All right. I miss it. Third coast, man. Lived in Cali, lived in New York, and then the Gulf Coast. It's the third coast. It's not too bad, other than the humidity. The humidity is shitty. It's like swimming out here in the summertime, when you walk around. So it's beautiful otherwise. Like Houston's a great town.
Let's not forget you had to get generators not too long ago.
Yeah. Well, we're expecting another big freeze coming up soon, guys. So that's gonna that's gonna not go well for most people. Get a freaking generator if you live in Houston. Weird thing to say, but climate change is real. Shit's going down. So, and don't eat the fish in the Gulf. It's gross. Mexico does a bunch of fracking that no one talks about, and they leach billions of tons of chemicals into the Gulf Coast. So it's something that's not talked about very much. And not that that's what we're talking about today, but yeah, let's not poison ourselves.
We'll give it a couple more seconds, see who else joins us. This is our first going live. I'm excited.
Yeah,
Are you
first
excited?
of many. Yeah,
We've been
I
talking
hear.
about this for a very long time. We're finally
I
here,
hear
guys.
we have a packed. I hear we have a packed 2022 schedule,
Yes,
so it's going to be fun.
it will be fun.
And nowadays they're talking about the whole metaverse. So you put on a VR headset and everybody can meet up on the moon if they want to nowadays. It's crazy.
My son already has the VR set. It's pretty
Yeah,
insane.
it's crazy. It really is.
All right. So, for those of you who don't know, this is Dr. Rahimi, the co-founder and creator of Suturebuddy. My name's Kailani, the CEO of Suturebuddy, and I'm just going to jump right into it. Why don't you tell us what you do now? What's the field you're in right now?
Well, thanks for having me. Uh, and so call me Jamal. Everybody who knows me knows that I like to be called Jamal. If you've met me, if you don't want to, that's fine. Dr. Rahimi is cool. My dad called me Dr. J, so he split the difference. So he'll get right in between there. So I do what I love, and that's emergency medicine. I'm an ER physician. I'm here in Houston, as we were just saying. A lot of the people here on know me personally as well. So uh, it's it's a roller coaster of emotions. It's what I wanted to do, and not knowing that I wanted to do it all my life, but I could not see that I being any other kind of physician than being in emergency medicine. So it's been an eye-opening experience. It's been very humbling to know that every breath is special, and it doesn't matter if you're a billionaire or you're homeless. Every breath is very special. You never know when you'll take your last one, and I've learned that very, My job reminds me of that, and it you can go two ways. You can get really depressed and sad, and that, or you can just stop and smell the roses and know that it's it's destiny for everybody. And I don't want to sound morose about it, but people always tell me or ask me like, "Am I dying? Am I dying?" And when I know they're not, like they're perfectly fine, I'll say, we're all dying, my friend, but some faster than others. So we're all dying. The clock starts as soon as we come out that womb, but some faster than others. And it's a humbling thing because it really does tell you just, stop, smell the roses, enjoy life. And COVID should have taught all of us that too. A lot of those very superficial things that we took for group, we're like, oh my gosh, this is so important. I got to wear the newest clothes. And how many of us spent like weeks in the same t-shirt? I mean, like, you learn to love the clothes you have and don't give a care about buying new ones and things like that. So it's like, it's a really humbling experience and really eye-opening to realize, what is really important in your life and what's not.
Right.
And then the important things, obviously, you miss them more and more as, time grows and distance grows, but knowing they're safe. And as you and I have spoken before, I tell you, like, I don't care if I see you in person during this pandemic because I want to see you on the other side.
It's true.
And that's the truth. It's like we can be 1,000 miles apart. That's okay nowadays. We have videos, we have this other stuff, but I want to see you in person alive the next time I see you. So that's the biggest thing. And that was the most eye-opening thing for me. But I've been doing emergency medicine through COVID. It's still here. It's still a thing. It is the truth. It's gotten much better. Obviously, everybody knows that. And hopefully we'll continue to get better and it'll just become, the flu, like the flu became the flu.
Well, I'm sure I speak for everybody, but thank you for being in the front lines, obviously, through this whole thing. I've talked to you throughout the whole COVID era, and I know how stressful and scary and how you were separated from your family and you risked your own life. So I'm sure everybody is so thankful to have you and amongst all your other fellow physicians and nurses and all those people. So thank you for that. But I would like to jump into how you came up with Suturebuddy, because I think everybody would like to know that.
All right. Well, so Suturebuddy is one of those things. So when I was a third-year resident, we all took, turns doing education for the medical students that rotated in the emergency room. And I ended up becoming a resident teacher of the year my third year because I really took to it. And really, that's when I realized, like, I really enjoy teaching medicine. Although I was still learning medicine, it was something I already knew that I liked to do. And so one thing that anybody who's been in any kind of medicine knows is when you're learning to suture and to stitch, there aren't good things out there. So we usually teach with like chicken thighs and pig's feet and bananas and weird fruit, things that are not realistic. Trust me. Slimy chicken thigh that smells like salmonella is not realistic. It's not your skin. Your skin's not slimy. You're not a dead chicken. So that's what generations and generations, that's what we learn on. That's what I learned on, right? So when I was teaching how the med students how to suture, I made my own pad by there's this really thick foam tape that you can find in the hallway closet somewhere in any hospital. And I would use a rag or a towel that, a surgical scrub that we opened a kit we didn't need. And I would wrap foam tape around that like several times, really thick. And I just made a cut in there once, like a regular old cut. And I found that you can actually, that foam tape could take a stitch. Like you can actually learn how to suture, and it actually gave you more realistic feel than the chicken thighs. And so I started making those for the med students, and I would make them every time I taught, and they would go home with them, and they would come back like, "Hey, I want another one. I want another one." And at some point, I remember someone asking me like, "Hey, I'll pay you if you give me more." And I was so busy, and I thought, I was like, "Oh wow, that's when it was like the epiphany. Oh my gosh, this is something that is a niche that nobody's ever done. But I put myself through college and med school, residency, all that good stuff. So I was quite in debt. So after I graduated, the first 3 years I spent paying off my debt to everybody, which I did. And afterwards, I was like, my wife and I was like, I want to do something else. I was pretty comfortable being attending, and I want to do something else education wise. And she was like, "Hey, remember that suture stuff you used to make for students? What do you think about that?" I was like, "Oh my gosh, I totally had forgotten." So then that's where we began developing the Suturebuddy. And thankfully, I paired with a company, a 3D printing company. They're more than that, much more than that, here in Houston, but now they're in Oregon. Lazarus 3D, big ups to Lazarus 3D. They make my pads. They won NASA Startup Company of the Year in 2019, and they do medical models and 3D printed models. So they make the best models of any day, and so they also make my suture pads. So we're like the Tesla of suture pads, because if you go on Amazon, they're all rubber, they're all styrofoam, like they're garbage. I mean, it just really is the case. So the ones that we developed, it's myself and 2 PhDs. We developed something that gives you real skin, what we call turgor, good elasticity. It looks real, and the cuts on there are going to be the cuts and the laceration that you're going to see on any patient, really. And so I designed those because that's what I do for half my job is bandaging people up for one reason or another, right? So I did it. We popped in a jaw last night, jaw dislocation. That was fun. So I haven't done one of those in a while. So we do a lot of different things in the emergency room. And so addressing wounds is a big deal, whether you're an NP in the ER, whether you're a PA in the ER, whether you're a resident, a med student, or the attending. You need to know how to stitch someone up. And there's no better way to learn than, as realistic as you can get. So that's where we have with the Suturebuddy. And we've now gone on to make several different pads and several different types and lines and different. So we're just ever expanding, and it's always been fun to watch it grow and to give my opinion every now and then when you guys feel you need it. Otherwise, you just ignore me, but it's okay.
All right, so tell us what your first suture was and how did you perform? And be honest.
So it's actually an embarrassing story. It really is, but it's something that I think the more you eat your embarrassments and learn from them and not hide them and tuck them away in a small corner and say they never happened, but learn from it and grow from it is the best way. So not enjoy, but I don't mind telling embarrassing stories about myself, in medicine and out of medicine, because I think it makes me a better person for it, and I get to grow from it. So I was an intern, and so believe it or not, I was maybe an intern for a couple days. We were doing these what we call shadow shifts, where you just kind of shadow the senior resident, and you're just learning and learning. But you're already, you've already done med school. You've already proven yourself to be worthy of working in the emergency room. So you these basic skills you already know, right? So coming in as a day one doctor, you better know how to stitch, because you do that during your medicine, when you're a med student, when you're rotating. And so this one, I tend to be a black cloud, and a black cloud in medicine means very bad luck. So the first patient that I had it was obviously not my patient, but the senior resident calls me over, is like, "Jamal, we're going to go put a central line in this patient with status epilepticus." So status epilepticus is someone who's having a seizure and it's not fixing with any medication. So they're just seizing, going. So, they're going to need to be put on a ventilator. We're going to need to give them IV medications to completely paralyze them, right? So that has to happen. And then in order to keep their blood pressure up, sometimes you have to put in a big IV into their groin or somewhere else to give them enough fluids and things like that to keep their blood pressure up, right? So guess what? This guy is seizing because he's bleeding in his brain. So as we walk into the room, he's seizing. There's a neurosurgeon drilling a hole into his head to relieve the pressure from the bleeding in his brain. The attending had already intubated the patient. And I literally I don't know. I mean, I don't know how I stayed dry down there, you know? Like, I don't know how I didn't poop myself because I looked at my senior and I was like, are you effing, like, are you kidding me? This is real life now. This is not a game anymore. Right now, I'm a doctor, but I'm an intern, so not kind of a doctor. And I look at her, I was like dumbfounded, like, what? You're going to have me put this central line into this guy who's still seizing? And Dr. Teresa Deek, big ups to you too, said one of the nicest, the strongest things anybody could have ever said to anybody. She looked at me, she said, I'm your senior, I have faith in you, and I got your back. And I was like, all right, that's all I need, because then it's your fault if I mess up. so everybody kind of gathers around. This is a case where, you know, maybe a slow day, I don't remember the circumstances, but all the other attendings from all the other parts of the ER come in, all the residents are coming in. And I do the central line, so I this huge IV. Should have been the hard part. So I get that, I get the IV, and yeah, I'm like feeling good. You know, everybody's around me. It's like the surgical arena almost, you know, because I'm short and everybody's tall, and they're all looking over. And when it comes to stitch the IV into place, because it's when you stitch down, I froze. Just that.
Oh, no.
And I froze, and he's still seizing, and the hard part was already done. The IV part was done. Getting it, doing all it, like everything was done. Now I had to secure this IV, and I freeze. I'm like and I don't know how long that was, because I hear somebody who was attending, who, before I say what he said, I liked the guy a lot and I understand where he's coming from. Dry humor, didn't know him back then, but I hear, and I didn't know it was him who said it, but I just hear from, because I can't look up at anybody. I'm drenched in sweat because I forgot how to stitch and suture.
Oh my gosh.
You know, the founder of Suturebuddy now, right? It's like
Well, that's great.
it's like Captain America. He's skinny and he goes and he's Captain America. You're like, that was Captain America? Yeah. Not that I'm Captain America, but I hear this come on down. Everybody hears it, obviously. It says, I hope that intern I hope that intern wears Velcro, because he sure as hell doesn't know how to tie.
Oh,
And then
wow.
then that person walks out, and that pissed me off to where it just like triggered something of my recollection. I was like, I got it. and you know, but that was a rough start. Although I did the hard part and I got the hard part, it was one of those things. And so I went home, and maybe for weeks I sutured my couch. You know, I took sutures and I would like pretend to I would cut like corner, you know, like little
Right.
holes into my couch in different parts and stitch them back together. And I promised that would never happen again, and never did happen again. But you know, it was motivating for me. Although medicine can be very dictatorial and patriarchation and all that. You know, sometimes I'm not one of those that, I had a hard training and I trained my residents hard and I'm hard on them. No, but I like the way I was trained. And I feel when you're there and this trauma surgeon says, and you're in their world and sick you and you're a resident, they say jump, you say how high. I mean, you're here to learn during those times, and you learn. And all the, screaming, yelling, throwing, vitriol, anger, those things should never be there. But I don't think it should be so, pat you on the back for everything you do as well. So I think it's a good little bit of both. And as long as you absorb those embarrassments and then learn from them, right? So that's the biggest thing. So quite embarrassing. Never forgot again. But it was something, because you knew how to do that. That was something you had to prove in order to, as a med student, that's all they sent you to do was go suture that kid up, go suture that patient up, because no one wants to do it anymore, because it's that, you get really good at it. So that's my story.
That's great.
Yes.
Well, that lines up well with my next question. Who are you reading? Balance. Sam says balance. That's great.
It's true. She's right.
Yes. My next question would be, who would benefit from the SutureBuddy?
Well, so I'll tell you what really, let me start with a quick story. I know we might even be going over, but when I had my first prototype, and I'll show you, when I had my first prototype of one of these pads, I was still like, we're not there yet. It's like late 2018. And my niece and nephew and some family were visiting. Okay. My niece at the time was 8 years old. So I told her, I was like, Aaliyah, come sit and let me teach you how to suture like a doctor. And I mean, mind you, she's a genius in every way. But I taught her how to suture and do a simple interrupted in about 15 minutes. And she was running and closing every freaking one. And that's all she was doing the rest of the day. And she enjoyed it because it was like, and she goes, Uncle, like, really? Like, this is what you do? This is pretty easy. And I'm like, well, for you, of course, like, everything's easy for you. But I'm glad, she learned it pretty fast. And that's what settled me on like, wow, this is like legitimate. It really does work, and it really does teach people how to do things. And that was the selling factor for me officially to keep moving forward, was like, wow, watching her suture like I watch my resident suture now, So who can this benefit is anybody, high schoolers, fetal pig dissections. That's gross. Why are we dissecting pigs and cutting dead animals? Don't buy my SutureBuddy. I don't care. Buy something else. But there's a lot of stuff out there to use nowadays. You don't have to use dead animals anymore. So stop. Yeah. And that's just the PSA in general. But so you can go down as used to do some suture workshops, and the youngest person, other than my 8-year-old niece, I taught, she was 18 or 17 at the time as well, and she was running them like a champ as well. So anybody who wants to learn, I think high school be above, really, and all learning how to do basic first aid is important. And everybody, especially if you're hiking and stuff like that, knowing how to do a quick baseball stitch to close something up fast so you're not gushing blood out or something, it's a good thing to keep in your repertoire, especially if you're a survivalist. Now, and then as you go on, college students, let's say you're going into dental school, vet school, med school, NP school, PA school. There you go. Like blank school, like, whatever, like, law school, whatever. If your client punches you in the face, you sit yourself up. There you go. It fits. You can go, this can be used at any level up to the attending level. So we're talking people who've done this for 30 years at workshops that I've done across the country. Other doctors who are much older than me, and we'll sit there and we'll suture on these pads and talk about different ways to do it, and they'll teach me new things, and I'm always impressed, and it's always a good time. And so they love these things because it's just cool to see how technology has advanced as well. So anyone from anywhere, if you're doing fetal pig dissections or dissecting squids, all the way up to you've been doing this for 20 years and there's not a single suture you haven't, thrown or done, it fits for any of you guys.
That's great. All right. So to our listeners and followers, most of them know you. Do you guys have any questions you'd like to ask Dr. J?
I would love some questions. Yeah, if you have some. Not about, it does not have to be about SutureBuddy. Absolutely not.
Now you just opened up the can of worms.
Yeah, we should do these more often, and with a lot of different topics. It'll be fun.
It would be fun. Definitely. All right, why don't you tell us about all the promos for the rest of the year? What's the discounts?
Okay, so we're doing, I believe, we had our Black Friday, which was pretty good, and then we're doing the rest of the year. It's 15. God, you guys are gonna hate
Let me help you out. 15% off is Code Buddy.
Code Buddy, only $2.99
for shipping in the US for $99 or over.
Free shipping, $99 or over. and $2.99 shipping in the U.S. otherwise.
And
Okay, see, hey, I did my
free
homework.
goggles.
Oh,
Yes.
no, a lot of freebies. Okay, Get a lot.
Free goggles with any purchase of an actual kit.
Oh, nice. Okay,
Okay.
I like that. That's great. You never know when a needle can just shoot at you. You need those goggles, man. You need them for all different things. Yeah, no, they're great. They're great. So, I love this. I think we'll do this again. We'll do it in a for many different reasons. If you're not buying my Suture Buddy, tell someone else to buy it.
Yeah, start liking and sharing. And we have a YouTube channel that has a lot of tutorials on there that will help you out. And 2022, we have a lot of planning to do. We got a lot of med conferences to attend. So if you guys,
Yeah, we'll be doing live shows from the conferences. So we're going to go to a snake venom conference in June. We've got a couple of American College of Surgeon conferences, and so we'll talk to some doctors. We'll see. We'll be us. And
yes, we'll be out.
it'll be fun.
Well, this is fun, and we'll definitely do it
This is
again.
great. Thanks, everybody. Appreciate you guys.
Thank you.
It was awesome.
All right. Talk soon.